Pancreatic cancer remains a devastating malignancy, and developing effective immunotherapy has been particularly challenging. Load 703 is an engineered adenovirus that is oncolytic in that it replicates selectively in cancer cells, thus leading to cell lysis, and immunogenic in that it is armed with a transgene cassette that induces expression of immunostimulatory epitopes. LOCON-001 was a phase 1/2a dose escalation single-center trial in which patients with treated or treatment-naive advanced pancreas cancer received standard 4-week cycles of nab-paclitaxel gemcitabine chemotherapy plus 6 to 12 doses of load 703 injected into the primary pancreatic tumor or a metastasis by EUS or image guidance. 3 dose levels were tested and the primary endpoints were safety and feasibility. Of the 21 patients who received at least one load 703 injection, 80% had metastatic disease and about half had already received first-line chemotherapy. Of the 18 patients who received at least 3 load 703 injections and were therefore deemed efficacy evaluable, the objective response rate was 44% and disease control rate was 94%. The waterfall plot on the top right of the slide shows that CA19-9 fell by 50% or more in 56% of patients. The bottom right figure shows that favorable treatment-emergent immune responses were detected. Most side effects were attributed to standard chemo with expected frequency and severity. The most common adverse events attributed to load 703 were fevers, chills, nausea, and transaminase elevation. Only a single dose-limiting toxicity, a transient and asymptomatic grade 3 AST elevation, was attributed to load 703. As such, the endpoints of safety and feasibility were met. In conclusion, combining load 703 and nab-paclitaxel gemcitabine was shown to be safe and feasible with promising efficacy. Treatment-emergent immune responses were observed, and a follow-up clinical trial combining load 703 chemotherapy and the checkpoint inhibitor atezolizumab is accruing and nearly complete.